been doing in the interim briefly. And when Delegate Ebersol joins us, he'll say a few things if it's appropriate, if we can squeeze him in.
Sure. Thanks.
Okay,
Thanks, Ariana.
The committee is live. We're live.
Okay, welcome everyone to the Joint Committee on Children, Youth, and Families. This is a joint committee of senators and delegates. For our topic is quite obvious from our title. Today we're focusing on childcare and family support. And so we're getting a presentation from MSDE, then the Maryland State Child Care Association, and the Maryland Family Network. We're also going to have a brief roundtable discussion about voting on our joint committee recommendations. We will not be voting on those recommendations, but we've had 3 meetings, and there are things that we believe we should take up in the upcoming session. And the purpose of our committee that meets during the interim is to really do that research, hear from constituent stakeholders, and then have an opportunity to discuss that. I'm not sure that I said my name. I'm State Senator Mary Washington, and I represent the 43rd Legislative District. And again, I'm welcoming you to the third meeting. My colleague and co-chair is Delegate Ariana Kelly. Would you like to introduce yourself, Delegate Kelly?
Sure. Thank you, Senator Washington. Just really quickly, Delegate Ariana Kelly, happy to be the chair on the House side of this committee and excited for the work we've been doing all interim.
Great. And so could each of the members introduce, and Delegate Kelly, would you begin with the delegates, and if you don't mind, and they'll start, and then the senators, and then we'll do some housekeeping and get started.
I do see Delegate Krebs just popped back, so let's have her introduce herself while she can.
Hi there, I'm Delegate Susan Krebs. I'm on the Health and Government Operations Committee, and I serve in Carroll County.
And I think Delegate Ebersol is going to be late to the meeting, and I don't see Delegate Atterbury here yet, although she should be here soon. Delegate Solomon, do you want to introduce yourself? And welcome, thank you for joining our joint committee for this meeting.
Sure. Thank you, Madam Chair. Delegate Jared Solomon from Montgomery County. I serve on appropriations and I'm the vice chair of the Education and Economic Development Committee, and appreciate the invitation. A lot of us have been working collectively on the issue since April, so appreciate the opportunity to be here. Thank you.
Great. So we'll start with our senators. We'll start with the senator from Prince George's County.
Good morning, everyone. I'm Melanie Griffith. Happy to be here. I represent the 25th District in Prince George's County, which is central and southern Prince George's County, and I'm happy to be here.
Great. Also, Senator Eckert, would you like to introduce yourself?
Thank you very much. Pleasure to be here. And I am from the 37th Legislative District, which is all of Talbot, Dorchester, a third of Caroline, and 1/2 of Wycomico County. And I serve on Budget and Tax and Human Resources and Health Subcommittee. Thank you.
Thank you. And then the good senator from Baltimore County.
Yes, good morning. Charles Sidnor, representing District 44. Which covers both Baltimore City and Baltimore County. I serve on the judicial proceedings.
And I believe we're joined by the other senator from Prince George's County. I believe that's Senator Benson. You have to you have to unmute yourself.
Thank you. Good morning, everybody. I'm Joanne C. Benson from the 24th Legislative District. And I want you all to know that I have been traveling this road for over 20 years in the House of Delegates and now in the Senate. This has been quite a journey. And I am very, very glad to be serving on this very important committee because, you know, I am all about children, our senior citizens, and those who can't speak for themselves. I'm just glad to be a part of this committee. Thank you so much. And I want to thank the chair and the vice chair I want to thank you all for the work that you do for the people in your district. A lot of times we do things and people don't say thank you, but on behalf of those who don't have enough sense to say thank you, I want to say thank you for the work that you do.
Well, thank you, Senator. And I will note that all of the senators that are on this committee also served in the House. So there's a great deal of respect with our colleagues. And so that continuity of service is great. So before we hear from our presenters, we'd actually...
Senator, sorry, I want to make sure Delegate Atterbury has a chance to introduce.
Oh, I'm sorry, she joined. Okay, sorry.
Thank you. I'm sorry I'm hopping on just a few minutes late. Thank you. I also want to thank our chairs. Well, one, I'm Delegate Vanessa Atterbury, and I too am I'm Vice Chair of the Judiciary Committee, and I'm a huge supporter of children and families and youth. I use that lens from everything I do and all the legislation that comes through the House. I don't know if that's because I have 3 very active children, young children, so it's constantly in the forefront of my mind. But I want to thank Chair Kelly and Chair Washington for their leadership on these issues over the years. I echo the sentiments of the fantastic Senator Benson. So thank you for letting me say hello to everyone.
Well, this is great. It's a great way to start this morning. Thank you all so much. We're going to hear from Delegate Solomon, who's going to give us some updates on what his group has been doing, and then we'll do our presentations. That works for everyone? Great. All right. The floor is yours, Delegate.
Thank you very much, Madam Chair. Again, it's a real pleasure to be here with so many of my really favorite and distinguished colleagues. So we very early on, a group of us, some of the folks who are members of this joint committee, folks from the Senate Authorizing and Budget and Tax Committee, as well as the House committees, really just sort of got together to make sure that we were focusing on childcare from a lens of not only what's happening with children, but I think the quote that I love to use is, childcare is really the workforce behind the workforce. We know that not only do we need high quality childcare to make sure that our kids are being taken care of and in a safe and nurturing situation, but we also need it because people have to go to work and they have to know that their kids are being cared for while they're at work. And the pandemic has been particularly hard hitting for women, who are primary caregivers usually. And we need to make sure that our women can get to work, that everybody has an equal opportunity. And so, we've been working not only closely with MSDE, but also with the Department of Commerce to make sure that from the small business perspective, that providers are being supported, because while they play that dual role of not only educating our children, they're also small businesses. And so, I appreciate that MSDE has been working closely with us. I think there has been a frustration, frankly, that we have not seen more aid, writ large. And that doesn't just fall on MSDE, that falls on the administration to save our providers. And I think MFN and the folks on the call today are going to do a wonderful job of highlighting the needs that we have. And so I'm really grateful for again, this committee convening this briefing and for all of us continuing to work going forward, because we know the pandemic's not getting any better at this point. If anything, it's going to get worse, and we need to make sure that every provider has an opportunity to stay in business, provide support for our children, and that when we do come out of this, we have a robust childcare system that, frankly, needed support even before the pandemic, and is certainly going to need it after. So again, grateful for you all being here, grateful for the opportunity to join you, and thank you again.
That I'm muted. Just want to let everyone know what Delegate Kelly and I do is we alternate between sort of being the primary hosts of the committee, and I believe it's my turn. So next we're going to hear from MSDE. I believe it's Stephen Hicks, Assistant State Superintendent, the Division of Early Childhood. And also we'll hear from Carol Williamson, who's the Deputy State Superintendent for Teaching and Learning. Welcome, both of you. So do you have slides? I believe
Yes, I'll be pulling those up now.
Great. And Mr. Hicks, oh, there you are at the top of my screen. It's good to see you. All righty, good.
Thank you. I know Dr. Williamson wanted to make some opening remarks.
Please do, Dr. Williamson.
And I've already made some of them, and I was not unmuted, so I'm very sorry about that. And now I have lost what I had, but okay. Well, I just said, I really wanted to thank you, Senator Washington and Delegate Kelly, for the opportunity for us to speak with you today. And Stephen and I both are very much supportive of many of the initiatives that Senator Solomon, Delegate Solomon alluded to, and we are very much involved in having conversations about how we can help to improve childcare services across our state. We're now in our 8th month of the pandemic. Last spring, our staff acted quickly to help many providers who stepped up to offer childcare for essential persons. At that time, 29% of our 7,600 providers were operating. As the state began to open up, our supply of childcare in the state grew to meet the needs of working parents. Today, thanks to the hard work of our licensing specialists, supervisors, and managers, we have 87% of our family childcare home providers and centers open. We also support our many grantees who provide critical programs and services for Maryland's families as they face the challenges of this new normal. I'd like now to introduce Stephen Hicks, who's our Assistant State Superintendent for the Division of Early Childhood. He's going to share with you about the Child Care Scholarship Program and childcare during the pandemic. So Stephen, I'm turning it over to you.
Great. Thank you so much, Dr. Williamson, and for your amazing commitment to early childhood at MSDE. I want to also thank Senator Washington and Delegate Kelly for this opportunity to meet with you and the entire committee. And thank you, Delegate Solomon, for your remarks and your commitment to the children of Maryland. I'm going to share with you today about the Child Care Scholarship Program and our efforts while facing the challenges of this pandemic. Next slide. Here is a brief timeline of the events since March. I won't go through each date, but suffice to say, we have been enduring this for about 8 months, and I know all families and children in Maryland have also been enduring this and trying to make the best of this situation, staying safe, staying healthy, and following the guidelines of the CDC and those who are in childcare programs, the guidelines for which we have put out with the Department of Health and Department of Human Services. Next slide. At the beginning of the pandemic, we worked with stakeholders to create a path forward with our response plan that mirrors the school response plan and is built upon the governor's blueprint for recovery. We've worked through all 3 stages now of that recovery effort. I know that many of us expected that we would be at a different place this fall than we are, but we are continuing to use the groundwork and the foundation of what we've learned to move forward through this next year. Next slide. Here are some of the ways in which my Division of Early Childhood at MSDE has worked together with stakeholders to support childcare providers and the families at the beginning stages of the pandemic. We had restrictions of services to just essential personnel at the beginning. We paid for the childcare for essential persons using our funding from the CARES Act and the Child Care Development Block Grant. We also ensured that child care scholarships were not interrupted with payments to providers, whether they were open or not, or whether the children and the families felt safe to return or not. We also continued payments for the pre-K expansion grant, and those are continuing now as well. Next slide. Since the beginning, we have worked with our partners at the Maryland Department of Health to develop and continually update health and safety guidance. At the beginning of the pandemic, we were meeting every day. We've scaled those meetings back to twice a week, but we do constantly check in as we learn more and as CDC guidance evolves and changes throughout this pandemic. A few weeks ago, we launched an online module of health and safety during the pandemic for all staff at child care programs, and to date have trained over 3,000 educators and child care staff in family child care home, center programs and also in centers. Next slide. We have spent approximately $94 million during the pandemic with tuition for essential personnel and grants to child care providers. Some of these grants were the $2,000 grants that were given to those initial providers that stepped up to provide child care for essential persons. And then we've also provided grants of $800 and $1,600 to help as programs reopened and provide them with some resources to cover the cleaning, disinfecting, and also cover some of the costs for the PPE. Next slide. Here's the timeline of some of the changes from March grouped around different key areas. At the beginning of the pandemic, prior to the pandemic starting actually, we had regular licensing ratios and capacities of, for example, pre-K was 20 per room. We needed to quickly restrict those per the governor's executive orders to 10 per room. And then as we moved through the stages, we've expanded that to no more than 15 per room. And now we're back to licensing capacity. And as you can see, at one point we had only 29% of our child care programs open. We are now back to 87%. Next slide. This just shows a graphic of our closed programs versus open programs. With the hard work of the staff, as Dr. Williamson mentioned, and the resilience of the child care community, we do have now 87% of our child care programs reopened. 80 providers, or less than about 1%, have permanently closed due to COVID-19. We do see programs close every year. It's a very difficult small business to operate. They're working on razor thin margins, trying to keep the cost of childcare as affordable as possible and still cover their overhead and other costs. But we did see 80 providers during this time specifically point to the COVID-19 as the cause for them to close and surrender their license. 2/3 of these were family child care programs. Next slide. I know this graphic is difficult to complete, this table, difficult to see probably the small font, but hopefully you'll be able to take a look at it later. You can also go to our Division of Early Childhood website and see these data being updated. We have varying success from jurisdictions in their ability to recover. We have 4 counties, Calvert, Queen Anne, Somerset, and Worcester, that have completely reopened all of their programs. Some of the larger counties, Anne Arundel, Baltimore, Montgomery, Prince George's, and Baltimore City, have further to go, but are still above 80% reopened. Most other jurisdictions have their childcare programs mostly reopened. Next slide. There is a difference, though, of reopening between our family child care programs and our centers. As you can see in the first 2 columns in blue, overall, we do have more family child care programs in Maryland than centers. This is actually atypical of many states, but 53% of our licensed child care is family child care. Those that are operating the family child care has 89% of the total family child care programs that are licensed opening, and the centers, 82% of the licensed centers are open, leaving 11% of family child care still to open and 18% of centers still to open, for a total of 13% that we're having our licensing providers continue to work with their caseloads. Now, it should be noted that we may never completely have all of our licensed programs reopen. Sometimes providers, especially family childcare providers, hold on to their license, make sure it's renewed, even if they're not planning to, in the immediate future, reopen. Next slide. I want to share with you some of the policy changes of which I'm sure you are aware of the last couple years. In July of 2018, provider reimbursement rates increased to the 20th percentile based on the market rate survey. This is based on the cost of care survey that we do for all providers in Maryland. It should be noted that previously it had been at the 9th percentile. In August of 2018, income eligibility for families increased to 65% of state median income. Previously, it was 33% of state median income. In July of 2019, provider reimbursement rates increased to the 30th percentile. And in November of 2020, we will be raising the provider reimbursement rates to the 60th percentile. And thank you for all your work in making that happen through the legislation. Next slide. This graph shows you the impact of some of those changes beginning in state fiscal year 2019 that I mentioned, but you can see over many years the number of children and families that have participated in the Child Care Scholarship Program. I think that we've made tremendous progress in the last 3 years. We've seen a 50% increase in the number of children served. This is good news, but still less than the 25,000 children served previously in state fiscal year 2011. Next slide. These policy changes have resulted in higher expenditures, of course. In state fiscal year 2018, the income eligibility level had declined to 33% of SMI, and the scholarships were at the 9th percentile, as I mentioned. Thanks to the efforts of the governor, the Board of Education, and the legislature, more families are able to be served in high quality programs in Maryland. Next slide. Thank you so much, and we'd be happy to answer any questions you may have.
Unmute myself again. Great, thank you. Any questions? Oh, before we get started, I just want to recognize that the good senator from Baltimore County, the other good senator from Baltimore County is here. I didn't see her in the first pass. Senator, would you like to introduce yourself?
Hi, good morning. I'm Shelley Heddleman from District 11 in Baltimore County. Happy to be here and just happy to be listening to these important presentations so critical to so many families today. So thank you.
Okay, if your members have any questions.
Senator, if I can ask a question of Steve, thank you. I'll recognize myself. Sorry.
Yes. No, I was gonna pass it off to you anyway because I was wrong. This is your meeting. I just.
Oh no, it's fine. I'm happy to have you running it. I think we're both running around as a lot of the members are. It's a hard morning for all of us, but this is so important. So Mr. Hicks, thank you for joining us again and for your excellent presentation. I was excited to see that you plan to get up to the 60th percentile in November for those subsidy scholarship rates. So I just want to note that because I think that was an outstanding question for me. And then also, can you just give us a little history? I've asked this question before. I know the answer in the back of my brain, but I can't recall it. And so I'm sure there's new members on the committee who can't recall either. What happened in 2010, 2011 that caused us to plummet and that we're building back from? And what we're doing to make sure that doesn't happen again in the future.
Sure. So at the time, and this predates my time, of course, at MSDE, there was the recession and there were funding cuts made in the state budget. And as a result, levels were frozen for in our income eligibility and in order to stay solvent. So fewer children were served. At the most extreme, the only children that were served were those that were on temporary cash assistance. And then slowly over the years, the eligibility began to rise until that 33% of income eligibility. And then, as you can see by the graphs, we had a huge increase when we made this the scholarships available to more families in order to qualify, and that the value of those scholarships has made a difference in families being able to access those to pay the high cost of childcare.
So I think basically what you're saying is the two increases have to work in tandem. We have to increase family income eligibility and increase the provider rate to make the scholarship really work for the family. And so
yes, exactly. The scholarships need to be significantly valued so that parents have a reason to be able to use them and the ability to be able to use them. And then you need enough parents to be able to qualify to be able to use them. So right now we are at 65% of state median income as the income eligibility. The Department of Human Services permits up to 85% of state median income. And then for the scholarships, the provider reimbursement rate is going to be, as we said, in November to 60th percentile. The U.S. Department of Education recommends as going up to as high as 75th percentile.
Wonderful. And we have a question from Delegate Atterbury.
Thank you, Madam Chair. Quick question, and thank you for your presentation. In terms of the providers reopening, and I was happy to see that a lot of them have reopened, but I'm still concerned about providers who haven't been able to reopen. Could you just give some comments on, do you expect, like I live in Howard County, so of course I'm focused on that, and it was like 86, but then I saw, I think Prince George's and Montgomery were in the 80s. Some of those that are lower, is there an expectation that those providers will reopen? What are some of the barriers that they are currently facing? I mean, I'm sure it's financial. Is it also, do they not have children to fill those slots? Like, what are some of the barriers, and what's the expectation in terms of them reopening?
Sure, thank you so much for that question. I think the answers are varied. So in some jurisdictions, as you know, there is a COVID rate that is higher than others. So in those jurisdictions where we haven't seen the rate as high, we know that those programs have opened more quickly and they are at a higher percentage of opening. I think it's a combination of providers being concerned that there might not be enough clientele to make their economics work. I think for parents, they've been faced with, and I know you probably have also, the difficult decision of thinking about your children being outside your home where there is the possibility of contracting the virus. And then, do you send them to a program? Are you able to take care of them at home? So I think parents have been reluctant to send, some parents have been reluctant, if they can take care of their children at home, to send them at home. Now, I know, as you know, it's very difficult, even if you're working at home, to care for your children. But I think parents have made some of those difficult decisions. And I suspect that as we see this rebound in the virus, that more parents may be starting to take their children out of childcare. It really varies community to community, whether they're at capacity or whether they have a waiting list, for example. But I think it's really a combination of that. Whether they need more supports, it's difficult to know. I do know that, I'm really pleased that 87% of our programs have reopened, and I don't know if it would be too much to say they're thriving, but at least they're able to stay open, right? And I think the financial support that we provided with the scholarships to continue those programs that were enrolled in that program, the Maryland Excels bonuses that we continue to provide for for programs that are at the higher levels of quality, 3, 4, and 5. They get an extra incentive for accepting childcare scholarship programs. I think those have helped. The grants of $2,000, $800, $1,600 have also helped. We are hoping that Congress will soon act on the many different bills and proposals that they've been considering, ranging from anywhere from $15 billion to $50 billion. This would be very significant for Maryland and could go a long way in helping in our recovery efforts.
Thank you. Madam Chair, can I have one follow-up question?
Sure.
Thanks. I am on judiciary, so this is my last question, I promise. So is there some, have like been best practices related to how to handle the children and the teachers been disseminated? You know, I know, you know, taking temperatures, not letting, from personal experience, not letting parents in the building, children staying in cohorts, like that type of thing. Has anything like that been distributed to all of the centers, you know, to try to help everyone stay on the same page and stay safe? And if there is a COVID-like, you know, illness, and obviously follow the guidelines and whatever, you know, folks can get the rapid results so people can get back in the school, the childcare center quicker. Is that something you guys have done? Or?
Yes, that's a great question as well. So our guidance has been based on the CDC, and we've worked very closely with the Department of Health. That guidance has evolved over the entire 8 weeks. It's posted on our website. As programs reopen, their licensing specialist reviews the guidance with them. They have to, when they reopen, programs are not just reopening on their own. They have to contact their licensing specialist. The licensing specialist reviews the guidance with them. The provider has to sign a form saying they read and understand and will follow the enhanced health and safety guidance. They sign that assurance. They send it back to their licensing specialists. We provide the cleaning and disinfecting and PPE grants to them, and they can reopen, but they cannot just open on their own. We're really being controlling about that. We also developed with Johns Hopkins University and part of our Maryland Excels program, a new module that takes all the staff through each of those guidance in a online virtual education module. And that's for all staff, not just the provider. Anyone that is coming into contact with children, that is working, you know, from the cleaning folks to the cooks, to the delivery people, to, you know, anyone, the teachers and the assistants, anyone who's working at the programs have to go through that module. In addition, in a few weeks, and right now we're piloting this, but in a few weeks we'll roll out to all providers an online planning program where they can connect the health and safety guidance that we have with a plan, to build a plan for what they're actually doing to meet that recommendation. And then they can print that out. We'll have all the data of those programs that have completed these plans. We'll have copies of the plans and what they're specifically doing. In preparation for this and our pilot, we collected best practices and photographs actually of what programs were actually doing for distance learning, mask wearing, cleaning, disinfecting, etc. And those are part of this new online tutorial.
Great. Wonderful. We have a couple more questions from the committee. So next we'll go to Senator Benson and then Delegate Solomon. Senator Benson? I'm not sure if Senator Benson
Hello?
there she is. Great.
Yes. I you know, I'm an educator by profession. I'm just kind of concerned about the distant learning. What kind of feedback are you getting relative to the providers using distant learning? Do you all involve them in intense training? Have they gone through a process? I mean, tell me how that works.
Sure, thank you for that question. So the child care programs, the family child care programs and the center-based programs, those are primarily like 98% in-person programs because they're providing childcare for the kids that need it, that can't be at home. So now those childcare programs are also providing distance learning for school kids in their programs. So for parents that they can't send their kids to school because the school is closed or it's not fully reopened yet, or they might be eventually on a hybrid schedule, childcare programs across Maryland are providing childcare supervision of their distance learning. Now, the childcare programs, I think, are at varying levels of success in that. They're not used to doing this kind of activity where they might be supervising several different grades at a time of school-age kids. I think the districts are connecting mostly with those providers that are providing that service. We do have quality grants that programs can apply for if they need additional support, and we have increased that. We've doubled those grants this year. We've also increased grants for family childcare providers for startup grants. It used to be $500. It's $1,000 if someone wants to start up a new family childcare program. Now, there are a few programs that we see as far as pre-K that are doing distance learning, the pre-K expansion grant programs, and project monitors are working closely with all of those pre-K expansion grants. These are for 3 and 4-year-olds to provide technical assistance as they do the distance learning, and also to monitor those programs. For the half-day pre-K programs in Maryland, and some of these are not the pre-K expansion grant because there's lots of pre-K. Prince George's County has lots of pre-K that mostly funded by the district. Plus there is a small amount from the school funding formula they get to provide pre-K as required. For the half-day programs, we recommend no more than 2 hours of synchronistic learning. And then the others are outside of using the computer time. And then for the full day program, we recommend, which would be 6.5 hours for pre-K, just like K through 12, we recommend no more than 3 hours. We don't want kids to be on the computers the entire time, using that screen time. Part of our efforts are to limit screen time for young children. Does that answer your question?
Yeah, that, it's a little concern for me because in a number of your daycare facilities, we have children there who are from 4 years old to, well, actually 11 and 12 years. And of course, I'm just concerned about how that distant learning is being, implemented in those centers where you have the children that have those different ages. I'm just concerned. Well, distant learning is somewhat of a concern for me anyhow, but
yes, right.
To do the best that we can to be sure that the people who are involved are adequately trained to do an admirable job when it comes to the education of our children.
Right.
Wonderful. Well, we have 3 more questions from the committee. Delegate Solomon, who will be followed by Senator Eckert and then Senator Hedelman. Delegate Solomon.
Thank you, Madam Chair. Stephen and Dr. Williamson, it's good to see you. Thank you for being here and for your work. The first comment I just wanted to make, and probably unsurprising as a member of the Appropriations Committee, I'd love to get sort of a more precise breakdown of where, the buckets of each money, each funding was used earlier on. And I think, obviously with the increased funding for scholarships and the reimbursement rates, I'd love to have a follow-up conversation on sort of the projections. Do we have enough money to cover, the increases, not moving that reimbursement rate until November? We're 4 months into the fiscal year already. What was the budgetary impact of that? I think that's the follow-up conversation that those of us on appropriations and budget and tax would probably be really interested to have or see some data on. And then the two-part question that I had, probably not unsurprising based on the conversations that we've had before, I guess. The first piece, I have some concern, as well as Delegate Atterbury, around the numbers of reopening. Montgomery, moving forward, had sent a letter to the governor. And I know some of the groups here are part of it. And I should have recognized, actually, Diane, who's going to be speaking later, and her husband, Joe, are actually constituents. So I'm really glad that they're here today to speak. But, the Montgomery Moving Forward letter, spoke about a number of the providers who are labeled as being reopened are really just reopened on paper. And I have a lot of concerns over that 82% number statewide. Obviously, those numbers, vary drastically in some of the larger counties. What does reopening look like for most of those providers? Is it, if it's only a handful of children, what are we doing to support them financially? Because that's not a sustainable model. And then the second part of that is, we've all talked about, school-age children who obviously in especially the larger jurisdictions are not back in the classroom. And for parents who have to work, the scholarship doesn't provide coverage for school-age children beyond just, the early morning and after school times. I know we're constrained by the budget here, and I know you all are limited in what resources can be allocated from the governor to you, but what are we doing to provide support for those school-age children and those families that have to go to work and, need a place for their kids, but, because of the virus, our schools are not open?
That's great.
Sorry, Delegate Solomon. So I think one of the questions you asked about was what kind of financial assistance does the state have for income eligible parents in the scholarship program, or could be outside of the scholarship program, I suppose, to provide for tuition for that full day. The only appropriation we have right now covers before and after school care in the scholarship program for eligible families. So those families can use those funds, their units of funding. We have the 3 different units of funding, but one unit of funding would be for the before and after school. So those eligible families can use that to help with the costs of tuition if they need to use a full day care, but we don't have an appropriation beyond that to provide full day care for all eligible school age children during the school year. During the summer, we do cover that. That is a planned budget expenditure, but that is not in the budget of the appropriation that we have currently for FY21. Was there another question too?
Yeah, and I appreciate the answer on that. I mean, I know, again, you all are limited to what I guess, I think our wish would be that in the care funding that we have and the flexibility that the governor has shown in other places, that we could figure out how to get money for those kids. But the first part of the question was, on paper, it looks like a lot of these centers are open. I'm hearing from folks in my county, and I think as we're hearing from my colleagues, those centers aren't open, or they're open at a very, very limited capacity. And I guess, do you all have any? The question was sort of, what data do you have on those providers that on paper may be listed as being open, but they're not? And that letter that was sent to you all, again, was concerning to me. And how are we supporting those providers who, again, may have a handful of kids, but that's not really sustainable?
Sure. First, I'm not sure which letter you are referencing. I have received letters from Montgomery Moving Forward. I've been participating in their meetings for a number of years. If you want to follow up and send that letter, I could reference it better, what the specific complaint is, or point is, or issue that they're bringing up. We don't have a way of taking attendance for all childcare programs, the small businesses, the private providers. There's no obligation or requirement in our regulations for them to report how many children they're actually serving, unless they're serving children using the childcare scholarships. We have not seen a drop in the number of families using the childcare scholarships, but we do not know the specific attendance of each of the 6,000 or so childcare programs that are open right now.
Thanks, and Stephen, I'll forward you the letter.
Okay.
That's again sort of the main concern is what does a center that's reopened technically on paper look like in reality? But I appreciate it. Thank you.
And I imagine that there is a variety. Some centers and family childcare providers are complete capacity, especially family childcare providers, and some have fewer.
Great. Okay, next question is going to be from Senator Eckert.
Thank you very much. Thank you, Chairman Kelly and Chairman Washington. And thank you, Steve and Carol, for your presentation. And a lot of the questions that have been asked kind of covered what I was looking for. I was looking for more of the specifics about how do we drill down how many folks in which areas are taking advantage of the child care scholarship, and what does that translate into? How many more can we serve from what we would have served had we not gone to the 60% that we're about to go to? So anticipation of that, but I also have several questions about capacity. We have a number of child care centers on the Eastern Shore that have capacity, but the problem is the child care scholarship only covers before and after school. And what these families, what these moms need is the full daycare. And even though the daycare organization may be able to provide some scholarship, they cannot do the scholarship that's needed to be able to meet the capacity and meet the needs of the community. So we have a lot of parents who are not able to work because they're not able to get that additional boost to be able to have those kids in daycare, childcare all day. And I hear you say that that's probably not going to be addressed. I guess I was looking for a little bit of flexibility, particularly under the COVID restrictions and unique situation, to be able to keep these families gainfully employed and get adequate levels of child care. So if there's any other way I can support that, I'd love to, because we still have a tremendous need in many of our counties on the shore.
Right. Thank you for bringing that up. I know this is a definite challenge in many communities. I know that some local school systems that decided to only reopen virtually have set up different childcare arrangements and partnerships. I know in Baltimore County and Baltimore City, there are arrangements with the Parks and Recs. There are arrangements with the YMCA to provide free or very low cost childcare programs for their students that need it. In Hartford County, I know that they set up learning centers that were provided not for all students, but for those most at risk or low income that needed childcare during the day. In Washington County, the school system has set up, contracted with a vendor to provide childcare for students. The superintendent and the governor are encouraging schools to reopen safely as soon as possible so we can meet this need that parents have. We have about typically 220,000 kids in childcare programs during the year, and this is usually typically non-school age children, right? We have 500,000 kids that are in elementary school in Maryland. That would be a lot of childcare to try to pay for and also provide if the state needed to do this. Right now, our appropriation for the Child Care Scholarship Program really doesn't permit that kind of expansion in services. We have the physical ability to issue scholarships. We have a vendor that conducts eligibility, that does the processing of payments, etc. I just don't think that we have the appropriation that would be able to meet that demand at this time.
Senator Eckert, does that answer your question?
Thank you. I'll keep working on it. Thanks.
No, thank you. I think it's a really important issue. I know Delegate Solomon raised it as well, and many of us have been talking about it. So I think we need to figure out a solution. Senator Hedelman.
Thank you very much, Madam Chair. I wanted to ask, and thank you very much, Mr. Hicks, for being here. I appreciate it. I wanted to ask, a number of us in the Senate wrote a letter late last week to the Secretary and the Secretary of Health asking about the dashboards and scorecards that are going to be issued in this COVID time, about the kind of information that's going to be shared by the department with regard to schools, both with regard to facilities, but then with regard to other aspects related to COVID, infection rates, staff, administration, et cetera. And I wonder if if you have any plans as we head into winter months, as the data show that the infection is unfortunately increasing in Maryland, to provide that kind of information to families. I don't think it's realistic, let me say from the outset, to do that for smaller family providers, but for larger centers and for school-based, I know the governor's really pushing to open schools for pre-K, and childcare, larger childcare centers, to provide information to families about both what is being done to make sure that the facilities themselves are safe, and the kinds of precautions and the kinds of resources that the state is providing to assist them, and also the kind of information about the health issues that we're all struggling with now, whether there are outbreaks, which would be horrible in a particular facility. If that kind of information, what is your plan for providing that kind of information to the public and to families?
Right, thank you. So from our perspective at the Division of Early Childhood, working with our Office of Child Care and regional offices, the licensing specialists are notified when there's any kind of possible or suspected COVID case. The process is that the provider notifies their licensing specialists and their local health department. So we keep a record that there has been a possible COVID case or with an adult or a child or a family member or something reported. Then the local health department makes a determination on what should happen. This is a whole decision tree that is in our guidance that we have online right now, similar to what is in the school guidance also that was put out by the Department of Health. So we keep those records. What we don't do at the Department of Education is do the contact tracing or the follow-up to find out if these were positive cases, et cetera. That is under the jurisdiction of the Department of Health. So it is the Department of Health that would have that information, and they would make the decision how to disseminate that information or to make it public.
So can I ask a follow-up, Madam Chair?
Mm-hmm. Absolutely.
Thank you. So if I'm hearing you correctly, this is totally a private information sharing on the back end through the health department, but there is no public facing dashboard scorecard whatsoever that is in existence now or being planned at all for childcare or pre-K. Is that accurate?
There is nothing planned like that right now that I'm aware of. I don't know if the Department of Health is planning to do something that's more public facing and beyond what we already have on the Maryland website, where you can see not specific to childcare programs or schools, but specific to different jurisdictions and communities on where there's been different cases, where you can see, like, the positivity rate, for example, in a specific county.
Well, I'd just like to say that there are a number of other states that are including them in their larger school information, and I would hope Maryland would take a look at New York, Minnesota, a couple of other places that are, I think providing this much needed information to the public. So thank you.
Great, thank you, Senator. Final question for this panelist is going to be coming from Senator Sidnor.
Thank you. I had a quick question. I know in some of our school systems, they're looking at their facilities, HVAC systems, and the like. And I'm wondering, for these childcare facilities that are going back online, are there any requirements, or are people looking their systems to make certain that filters and things are going to be changed, or that the air is going to be just good for these young children that are going to be back inside these buildings?
We have recommendations that we make to check and look at your the flow of air, et cetera, but there is no specific requirement for programs to do anything differently than they had done in the past. There's no specific regulation around that.
Thank you.
Mm-hmm.
Wonderful. I just had one more question that was actually emailed to me from a child care provider, so we'll close with that one. They're asking that they're hearing Mr. Hicks saying that the child care sector is currently thriving, and that's actually counter to their experience. And there's been a lot of news articles about the fact that the sector is not thriving. So maybe you could clarify what you meant by the idea that the sector is thriving, and maybe there's some people that may be thriving, others that aren't. I know our next panel is going to be childcare providers, so we'll hear more from them. But if you wanted to just address that, since it was a question that came into me.
Thank you. I appreciate the opportunity to clarify that. What I said was I couldn't say that the childcare community was exactly thriving. I said that there are 87% that have reopened, but I couldn't really say that they were specifically thriving. I don't have that information. I know that they are coming back online and reopening, but I don't have any information or data to make the claim that they're thriving. Sorry for that confusion.
No, I'm glad you had the opportunity to clarify. Any more questions from the committee for Mr. Hicks? I don't see any, so let's move on. Thank you so much. This was incredibly helpful. I know the committee appreciated it.
Thank you.
Let's move on to the panel on child care providers. That's going to be Christina Push, who is with the Maryland State Child Care Association, as well as two providers, Carolina Reyes and Diane Hines. Christina?
Great, thank you so much. Can you hear me?
Yes.
Great, thank you so much. Delegate Chair Kelly and Chair Washington and the esteemed Joint Committee on Children, Youth, and Families for having us speak today. We're grateful for the opportunity, and there's many champions that we've worked with before and during this pandemic that are on the committee, and we thank them for all of their support and engagement during this time. I'm Christina Push, the Executive Director of the Maryland State Child Care Association. We represent over 4,800 child care providers across the state of Maryland in every jurisdiction. And I'm going to talk about sort of an overview based on what I've received to present on, and then I'm going to defer to my panel, which I'm so grateful for them as well. We have two childcare providers and operators, owners of one in Montgomery County, as she has 4 locations, and one in Prince George's County, larger and smaller, just to give a better landscape of what's going on, and also to take your questions. So let me begin with our state of childcare. And thank you, Stephen and Carol, for doing such a great job of explaining some of the things that I have in here. I don't need to touch on because you already have. Childcare centers across the country and in our state, including big and small operations, for-profit, nonprofits, are teetering. The enrollment is decreased since the spring and is never fully recovered. Extra expenses, including PPE, deep cleaning, sanitation supplies, extra staffing to adhere to the childcare specific CDC guidance, are piling up. Some estimates that we read now show 40% of the United States childcare centers or childcare programs are closed. MSD has given you data on the Maryland childcare programs, but there is more to discuss behind those numbers. Many of those programs that are open have half the number of children or less than they did in February. My panel is a small representative example and will share their numbers with you. Just because Maryland may state 87% of childcare programs are open, it doesn't mean they have enough children or staff to sustain their businesses. A distinction to make is that the amount of slots available for families, and MFN may touch on this as well, includes family childcare pre-COVID accounted for 41,243 slots or capacity for families, and centers accounted for 187,569 slots. That's a lot of slots pre-COVID in our state. MSD has worked to support the family child care increases during COVID, but to be clear, center capacities have been much more impacted and limited during the state of emergency and have much higher expenses and are in need of stabilization and supports as well. I'm sure that you know, as lawmakers and economists also warned, that many childcare providers will fail without government assistance. If that happens, parents who struggle to find childcare slots before the pandemic are going to have a much harder time when this is over. Unfortunately and unfairly, the pandemic is already forcing many mothers out of the workforce, a decision that may hurt their career prospects in the future. And as my partners at MFM will also tell you, if parents can't work, the economy can't thrive. In the best of times, as Stephen touched on, the childcare industry operates on razor slim margins. Children come and go, which means revenue is unstable. Over 50 pages of childcare regulations and some of the strictest ratios here in Maryland tighten those margins. Banks are not beating down the door of small childcare businesses to lend, and they're tapping into their savings, running up costs on their credit cards, and having to charge families more than they can afford. It's difficult to rebound from a crisis, but especially a crisis of this magnitude. Childcare fixed costs are high. It takes real skilled people with specific state licensing requirements to do this essential and important work. Childcare can't automate jobs or cut their real estate costs by operating remotely. We have a situation that's like a mismatch. The wages are low. Our median national income hourly rate for childcare teachers are $11.65 per hour, according to the Department of Labor. And an average pay in Maryland for a childcare teacher is $25,860. But costs for parents are steep. Childcare for a single child can cost easily $10,000 a year. An average cost in Maryland is depending on the age of the child, but it's about $215 a week, according to MFN. And childcare budgets are super tight. 60 to 70% of the income goes to staffing. So if you lose 1 or 2 children, or you can't bring in those children, you have a serious problem. This is why capacities and ratios are so important to the childcare businesses, as Diane and Carolina will explain in a few minutes. 8 months into this pandemic, the government loans and grants meant to keep childcare programs afloat are running out. Our congressional representatives have been fighting for us, and we've been advocating with them for more federal funding. And I know this House has passed, and the Senate, God only knows what's going to happen and what our future looks like. We hope to find out more soon, but childcare operators are bracing for the winter, which threatens to bring a new surge of coronavirus infections that could keep more children home. And in June, the National Association for the Education of Young Children conducted a survey conveying that 80% of childcare providers said they expected to permanently shut down within a year. So we're still within that year, if they lost 20% or more of their enrollment. You'll hear today that many of our programs have lost 20%, more like 50% of their enrollment. Childcare providers' revenue decreased on an average of 35% from the first quarter to the second quarter, according to census data. Many programs have tried to invest in, as you were bringing up, the senator from Baltimore County, in air conditioning systems and ventilation systems, automatic soap dispensers, extra cleaning supplies, extra staff to adhere to the guidance, as I said previously, to maintain their employment and to make sure they can maintain their teachers whenever possible. For some of these programs, families have returned, but as positivity rates changing from state to state, the future is uncertain. All the programs I've engaged with have always stressed the priority as an already highly regulated industry is the safety of children and staff. Our member and colleague, Diane Heinz, will share her experience with the lengths they have gone to keep children and staff safe. Childcare programs, you will hear, have recommendations from the CDC that have more stringent than your retailers, your restaurants, your grocery stores, always adhering to safest way to operate. Yet the governor did not include or recognize childcare as an essential industry during this pandemic. Childcare is an essential public good service provided by private industry, but not treated with the same respect, priority, or investments. What MSCC is hearing from the industry is they feel like they're an afterthought and disrespected. U.S. as a whole, Maryland's no exception, lacks investment in public resources, and Maryland doesn't go above and beyond their required input as some other states do in our country with regard to childcare scholarships and investments in childcare. Some parents have pulled their children out because they've lost their jobs. Others are scared their children will get sick. But recent data in October, that report from Yale, which I've on our committee before we started, Delegate Krebs had mentioned that, and I did send that along to Emily from DLS to share with you. The Yale study shows that childcare is a very safe option for children, and there was over 57,000 childcare programs that were done, that were researched by Yale, and we've been very, very successful at keeping children safe and healthy during this pandemic, and previously before that. More than half said they were uncomfortable sending their children back, but we hope with the support of those type of surveys and medical research, along with the support for opening schools, that more parents will be able to feel comfortable and confident. But that is a choice that they deserve to make and should make. Many programs that remain closed are eating into their savings and paying for expenses like fire and security systems, liability insurance, other fixed expenses, along with deferring their rents and mortgages. Their bills will eventually come due. And even if they reopen, many are not encouraged they will be able to make it work. MSCC is hearing from many programs about concerns in maintaining and recruiting an already undercompensated childcare workforce due to the impact of the pandemic. Many are deciding not to return. Carolina will expand on her experience on this issue. This is upsetting, as childcare is an industry that keeps others working. Childcare has also stepped up in supporting the distance learners, as Senator from Prince George's County brought up. We have been working very hard to support them, but we also feel the need, as many of you have brought up, that we would love to see the scholarships or funding for a full day, because many parents cannot afford to pay a full day rate. And we're all doing our best to support this, and we don't see an end in sight. On top of all that, childcare programs are being required to shut down classrooms or full programs without a confirmed diagnosis of COVID-19. If there is a symptom or two of COVID, which includes typical cold symptoms, displacing children and parents who cannot go to work or have to scramble to find someone to care for their child or children are not being allowed back into their programs. I am not aware of any other industry that closes portions or all of their business without a confirmed case, only a symptom, and the vast majority of tests, which cannot be rapid tests, come back negative, which has frustrated all parties involved. There needs to be a revised protocol, or my panel have more suggestions, as safety is our first priority, but we need real data from the health department, as the percentages are extremely small of confirmed cases related to childcare, and the excluding the child, parent, or staff should be the protocol until the test results are available, not shutting down completely. There's no other business required to do this that we're aware of. I'll defer to my panel, and I'm very excited that they are here today. I'm going to start with Carolina Reyes, and she will tell you more about her program and the impact the COVID has had on her business. Carolina?
Hello, everybody. Good morning. I'm glad to be here. I'm glad to see that we have a diverse group of people here. My name is Carolina Reyes. I'm the owner and director of Arco Iris Bilingual Children's Center in Laurel, Prince George County. I am here to reach out to you today to make a loud and an important clarion call about issues that are affecting my small business and the families which relied on it. I first want to say thank you for all of those who have helped me during this pandemic. However, I would like to raise an issue of many I have experienced since reopening my center back in August. The overall COVID-19 guidance provided childcare centers are good, but the decision aid flow diagram that you probably have obtained from the Department of Health establishes that COVID-19-like illnesses includes any of one of the following: cough, shortness of breath, difficulty breathing, one or two of the following: fever of 104, chills, unshaking chills, headaches, nausea, vomiting, diarrhea, and fatigue. The decision A flow diagram states that person manifesting these symptoms must speak with their healthcare provider about getting COVID-19 tests and self-isolate pending results or evaluation by their healthcare provider. Moreover, close contacts of ill persons should quarantine for the CDC guidelines. I have been very, very diligent in reporting possible cases to the health department, but I wonder how many childcare centers are going through the same situation. I have reported 3 possible cases back in October, and all of the results return negative. Meanwhile, as a small business owner, I have to implement policies to maintain the viability of my center, such as charging tuition despite having these contacts closures. This is a toll for our families, but necessary to remain the business. But I wonder, for how much longer can I continue doing this before families abandon childcare completely? I lost 2 families because I closed my center. They brought a family member from another country to take care of their child because they're small business owners as well. So the contents close affect them. I take this pandemic seriously, and I'm trying my best to follow the protocols, the guidance, to protect my children, my families, and my teachers. However, we are entering a rough few months, with many other illnesses that are not COVID-19. Allergies, common colds, strep throat, bronchitis, and flu are the most common winter illnesses that we have to address. I am a strong believer that by working together as a community, we can help each other. I believe that childcare providers is necessary for all of us, or for you to understand that we are being affected emotionally, mentally, and economically. We need help. My families and my childcare business are hurting. I have some suggestions that I would like for you to hear. There should be a pool of funds especially allocated to cover tuition when centers have to close in case of a positive case or when awaiting for COVID-19 results. This will assist families, family childcares, and childcare centers monetarily in reducing the possibility of layoff and economic uncertainty for everyone. By implementing the previous recommendation, families will be able to cover days off due to the closing by paying temporary babysitters probably. In this way, families will be able to continue working and not to take unexpected leave, which they may need for serious family matters or sicknesses. Provide specific testing centers reserved only for children and teachers of childcare centers so the results can come back quickly. And I mentioned this because, as Chris said, we have to close to await for results, even though many times the results are not positive. And provide direct access to cleaning supplies for childcare centers. I am glad that we obtained $1,600 when we reopened my center back in August, but we need to have a particular place where we can go and find the supplies. It is very hard to drive or go everywhere trying to find some articles sometimes for cleaning and disinfecting. I also would like to say that I am glad that MSD is proudly showing that 87% of centers in the state of Maryland are open. But I would like to know how many children are enrolled in these programs. How many programs are on the brink of closing? I would like to stress that the closing of one center is one center too many. An 87% opening rate is, in my opinion, nothing to celebrate much. None of us are at full capacity. My center before COVID, I had a maximum capacity of 57 children. I have 19, but I lost 2 after closing 2 times my center. So I went down to 17 and I needed to let one teacher go because I am not able to pay her. We need funding for vacancies if needed. We are educating young children in a high quality and safe environment in order for them to be academically, socially, and emotionally ready for kindergarten. Childcare teachers matter. We care for our community children, and therefore we are essential to our society. We need help. We are professionals that love what we do because we believe it strongly that the education of more children will be better ensured successful leaders for our nation. But we cannot do this alone. We need you. Apart from financial support, childcare center needs encouragement, respect, and recognition as an essential frontline workers from legislative leaders. The pandemic has given us the opportunity for all to say loudly and clear that childcare is essential in our society. The state needs to invest on us, and not just during times of crisis, but investment in childcare must be on a continuous way. We can't just have those at the top giving us regulations and guidelines and protocols without childcare stakeholders to be included. We need to be at the table. We need to be included because we are the ones who are experiencing every day what we need. Many times we are left alone for us to decide on how our fate is. When I have attended, the state meetings, many times I was told, we cannot, when I had a question, we cannot tell you what to do. This is your business. Now is the time to start making a difference. Maryland can be one of the first states to show the rest of the country that we can establish a better childcare system starting at birth. However, this also entails recognizing that our childcare system is broken and needs support to aid our families, teachers, and children in our community. I strongly believe this can be done by working together. Gracias. Thank you.
Gracias. Thank you, Carolina. If you could flip through the slides, Anne, if you can go to the next one. I'm sorry, I'm going to hit Diana. And I'm sure these slides you have, so I'm not going to go through them. Keep going. I'm going to go to the last one. I talked about what happened in the challenges. There's a number of things in here to the very last one, and I'm going to let Diane keep going. I'm sorry. Okay, so Diane, if you wouldn't mind taking the lead now and bringing us home, and then we can maybe look at where we can go from here and some more ideas.
Sure. Hello, I'm Diane Hines. I'm the Executive Director for the Children in the Shoe. We have 4 locations in Montgomery County. We are big centers. Typically, we have over 500 families spread throughout our centers and over 200 employees. Prior to COVID, we were at 100% enrollment with strong, healthy wait lists. With 3 payrolls in reserve, we were looking at opening a 5th center, and COVID hit. We furloughed our staff, all 200 plus of them. We applied for a PPP loan. We got a grant. We opened up June 22nd. We were able to bring back all 200 plus employees, knowing that we were probably at about 30% enrollment. Our goal at the beginning of COVID, along with our families, was the health and our staff, maintaining our staff. We wanted to ensure that they would come back, that there would be a place for our families to come back. During the furlough, we paid 100% of our staff's healthcare. We paid and kept on salary any staff member who would make less on unemployment. We continued to pay staff who were having problems with unemployment, who couldn't get through the system, who couldn't make their rent, who couldn't buy groceries. We wrote personal checks, I did, from my account to ensure that our staff would be well taken care of and be able to come back. We're happy to say we were able to open June 22nd. We had 30% of our families come back. We are done with our reserves. We are through our PPP loan. We are losing money every month. We've managed to get our enrollment up to about 65%, which is okay. With the regulations and the health and safety protocol, which is something we took very seriously. We spent months during the closure getting ready to open and ensure that our families and children and staff would be safe. We are overstaffed, but we have to be to ensure the safety and the health of our families. We have, everybody needs to remain in their hubs, in their groups. We have one person who can be a runner. There's no mixing of classrooms. We are on the brink of losing it all. We are a family business that's been around for 40 years. My mother-in-law founded the Children in the Shoe. It was her answer to Latchkey Kids. It means a lot to us. We have always been a business that puts everything back into it for our families and our staff. They mean everything to us. Our average staff member has been with us 5+ years, which is huge in the childcare industry. We need your help. I'm going to echo what Christina and Carolina have said. Operating on these thin margins during COVID with, closing a classroom for the common cold. Also, I do need to bring up Montgomery County. Our capacity has not been lifted. We are still at limited, reduced capacity. This hurts, especially for, a larger business like mine. These are 50 slots that we cannot access because the health department, the county will not let us go back to normal ratio. That's 50 slots. I have wait lists of families who want to get in. I have families who have been with us since birth who decided to wait a bit, and now they can't get their preschooler into our center because the capacity won't be lifted, or it hasn't been lifted. 50 slots are a lot. It really is. The capacity restrictions is one of my asks. What are the metrics? How is this being decided? Where is the science? I go to a restaurant, I go in there, I don't have my temperature checked. Everybody's sitting around without their masks. They've got well over, 100 people there. They can be open, they can do this. They do not have the safety protocols that we put into place. We do temperature checks 3 times a day. We send children home with runny noses. Our parents, our community understand that it is a privilege to be open right now. We want to continue to do this, and we're going above and beyond. We need the capacity lifted. Since we've been open since June 22nd, we have had 1 teacher who was positive with COVID. It did not spread. We have not had any other COVID positive people in our center. We have not had anything spread. We have safety captains who are working constantly throughout the day, monitoring each classroom, wiping down high touch areas. We have bought HEPA filters. We have deep cleaning. We hire professional companies to come in every weekend and deep clean top to bottom. That's on top of what is happening during the day. We want families safe. We want to have a place for our families to go to, but the decision aid is killing us. It's, I'm on the phone with the health department, 4 or 5 times a day, just checking things through there. We are completely transparent, with our illnesses. They guide us. We follow their guidance. We close classrooms. Parents sit at home with healthy kids for 5 days, waiting for a child's COVID test to come back because they had a runny nose and a slight cough, common cold. But you do this in a classroom with 12 children. These are 11 healthy kids sitting at home with parents who can't work. Our parents are exhausted. They're not going to continue to pay when sitting at home, not being able to work because we're closing for the common cold. We're doing everything. If we can't keep the classrooms open, families don't have the service they need, teachers don't have the jobs they need, and we don't have the business. There is this, it's in my letter, which I think was shared, but the new rapid antigen testing that the governor purchased for the state. It's to be used first in hospitals, I believe, colleges, and one other facility. Why can't we have access to that? Why can't we have priority to this rapid test, considering, like Christina said, that we are being told to close for the common cold? We need to be thought about as the hospitals are. We need access to this rapid testing. And I think Carolina brought this up. Also, financial assistance when we have to close. If we're closing a classroom for 5 days waiting on a test result, we can only dip into our reserves, which are gone. We can only continue to take a loss for so long, and especially going into the winter months, we can see it in the crystal ball. It's there, it's written on the wall. If things stay status quo, we're going to be closed across the board all the time for runny noses, slight coughs, low fever. Kids get sick in the winter. They do. But there is no way to continue to operate with these guidelines. So I want to thank everybody. We are here. It's all about the children. We love what we do. We pour our heart and soul into it, as do our teachers. Our teachers, who, by the way, are high risk. They come to work every day, you know, knowing that they're high risk. They have to work. We want to keep those teachers safe, healthy with us. Same with the children. It's our main goal, and we need just a little bit of help from you all. So it's the 3 asks: lift the capacity, financial assistance if we have to close, and you know, access to those rapid tests. That would be fantastic. Thank you.
Thanks, Diana, for both
Christina,
of you.
Just a quick time check, Christina, because it's 11:26 and we have more presenters after you, and we have to discuss our recommendations, and you guys are adding, I think we're going to want to revise some of our recommendations. So
thank you all again. I do have some ideas on top of what was shared with my members that today that were eloquently able to share their remarks with you, but you can see those there. I don't need to read them to you. They were addressed by Delegate Solomon, by some of you. We would like to see all of these things obviously be addressed in some way, even a partial percentage of the full day funding as opposed to before and after school, even if it wasn't a full day, but it was even something we could access for those families in need who can't afford the differential, that we're supporting those distance learners, those type of things. So again, if we can be creative and work together. I will say Baltimore City has a $20,000 loan, not a loan, a grant for childcare providers. Montgomery County has a grant for to backfill some of the things. So there are some counties stepping up. I think all counties, and you represent lots of counties on this committee, would look at possibly putting in your budget. And then the state, I believe, does have access and flexibility to more funding, and maybe we can find out more about that. So thank you again for all you do in your committee, and we defer to Maryland Family Network. Look forward to their presentation.
do we have questions from the committee for this, from this panel? Anybody? I'm not seeing anything, but sometimes it takes a minute. I do have a quick question. We heard last month from the long-term care industry, and it sounds like many of your concerns are similar: access to testing, covering the cost of PPE. They also raised the issue of workforce and recruiting people to be able to work. Is that also an issue that you guys have been facing?
I can say yes, and I brought that up in my testimony, but I'm sure Carolina had to let one go, and Diana just spoke to the same thing. We're really finding it difficult. Women of color, especially diverse women, are impacted, more through the virus, and so bringing them back is difficult. And we want to maintain our workforce. The diversity in our workforce is so important. It models for those children exactly what we need and should have. So we want to be sure that we can do that. So yes, it's a huge issue. I'm hearing it from all over the state that finding and then recruiting and maintaining the workforce is very difficult.
Yeah, I just want to add again, I needed to let it go. Somebody that I hired a month ago, I have 9 teachers in March, and 7 of them didn't return. Some of them needed to be at home with their children. And so they are worried about themselves too. No, I'm a small center, and compare the benefits that I can provide sometimes are not enough for them. So, and like I say, and Diane say as well, we have teachers who are high risk and they're still coming because they need to work, because they love what they do. So yes, that's an issue that we are facing as well as many others, but we are trying to summarize it a little bit of a few.
So I did have one more question, which was for either of the center directors. Both of you sort of hinted at winter's coming, cold season is coming, more runny noses, more slight fevers. It certainly looks like in Montgomery County, my kids are not going to be back in school for the second semester. So can you just play it forward and tell me, what does January and February look like if we can't address the rapid testing issue, address the policies that have you close and wait 5 days for a test?
For me personally, being a small business, I am in the negative right now, running in a negative. I think I'm probably 29% children. I will be closing. You know, I have to pay rent. I have to pay the 2 teachers and myself that I have here, and closing. And families probably will be affected because, once again, they have to work. And we are trying to make policies to make our business to be liable, but you know, it's just impossible for them to continue paying for a place where they're going to be constantly closed if their children are only have a cold. And you know, and the symptoms are similar, and I understand that they want to do it for, you know, the safety and health of everyone, but it has to be something more flexible, at least for us who are essential for our families.
Well, and it's you have to have a confirmed case in most, and this is not even a confirmed case. This is just any symptom, and you have to shut down that particular room. Not tell the child not to come back. You have to shut down.
Yeah.
Without a confirmed case.
Diane,
I just want to quickly say, we have already lost families because of the room closures. They brought in nannies. Mom has quit work just to stay home because of the type of work they do. They need consistent, reliable, safe childcare. And yes, we have lost, I would say 6 families across all of our 4 centers because of these closures for common colds while waiting a PCR test, while their very healthy kids are sitting at home. Yeah.
And not just their kids, the rest of the classrooms children are sent home.
Yeah.
Yeah. And particularly if you have siblings in the school. I have siblings in my center. So even though I have 2 different classrooms, it's still, if they are close contact because they're siblings, they're together after they leave the school. So it is a very difficult time.
I'm very interested in that intersection between the not having access to scholarships for the school age children. I think, Diane, you serve school age children during the day. So if schools are still not open in the winter and childcare centers are closing and we don't have, so you know, it sounds like a perfect storm for me for working families and access to care.
Yeah.
Absolutely.
And
I would
also,
like to say
Delegate,
that
I think it's, if I could say, I think it also points out to the degree to which that we've relied on the public and educational systems to subsidize our childcare responsibilities to families. So it's really becoming, that is what our expectation is. And so we absolutely need to do something about that, that time in the middle. So I think that highlights that. So thank you all so much. And we do need to move on, but we will definitely be adding all of this, and the link to the long-term care, which is when our last meeting. There's just so many intersections there, you know, yes. So we hear you loud and clear. Thank you.
All right, and then moving on, now we're going to hear from Maryland Family Network, unless I don't see any more questions from the committee. I think we have Laura Wheel-Dryer and Clinton McSherry here. Who's up first?
I'm going to go first. Thanks. Good morning, Madam Co-Chairs. I'm Laura Wheel-Dryer. I'm the Executive Director of Maryland Family Network, and thanks for the discussion of this very important topic this morning. In the interest of time, I want to say that so much of what I'd planned to say this morning about why childcare remains so fragile would be redundant at this point. So I'm going to be as brief as possible and try to just reinforce some of the things you've heard directly from providers, which are so powerful. If you would flip forward 2 slides, please. I'm going to cut some things here. So as some of you will recall, MFN conducted a survey of childcare providers in the state of Maryland in May. The survey asked childcare providers about what impact COVID-19 was having on their program. And basically, I'm here today, as you've already heard from providers, to say things that were bad in May are only worse now. Month after month, providers are operating at a loss, and it's incredibly hard to sustain. Childcare is open, but enrollment is down. Now, you've heard Stephen Hicks share that there's no way that is tracked formally, but informally and anecdotally across the board, we hear that enrollment is down for a variety of reasons, which, again, you've heard some of today, and I'll talk a little bit more about. Next slide, please. We continue to collect data. We've actually sent out a survey of every parent who's called locate childcare in the past 3 years. The results are on the screen right now. And basically, in summary, parents are scared and confused about whether childcare is safe. You have many other factors as well. You have parents who are working from home, you have parents who've lost their jobs, and you have older children who are home from school, and some of whom have become de facto childcare providers themselves. There are rolling implications of all of these things for all of the children in the home. Next slide, please. Several folks have referenced this report that came out of Yale University just within the last couple of weeks. Yale surveyed more than 57,000 US childcare providers between May and June of 2020. And they asked things like, have your program stayed open? What safety measures have you put in place? And also, very importantly, what precautions are staff taking in their personal lives? And the big takeaways here are that strong preventative measures like mask wearing, frequent hand washing, keeping children and adults in cohorts that don't mix, kept childcare from becoming a significant source of infection. They found no association between contracting the virus and exposure to childcare. And that is some good news, and some news that can make us feel a little bit better. The latest data from AAP and the Children's Hospital Association shows that children make up 10.7% of all the cases in the United States. So I think one of the themes that you've heard today is that even if centers and family providers wanted to return to full enrollment, even if families are banging at the door out of need, which I think there's a lot of need, it's not really possible to keep these health and safety practices in place and return to full enrollment. Social distancing, for example, you can't socially distance, as challenging as that concept is with young children to begin with. You certainly can't even try with the same number of kids in the same square footage that you had prior to March 2020. Next slide, please. This may be a little bit of preaching to the choir because through your questions and discussion this morning, I know you are all committed to childcare and the vital role it plays in our state. So I just want to emphasize a few things here. This is not a Maryland problem. This is a national problem. And if the pandemic has highlighted anything, it is that childcare is an essential public good, inadequately supported by public sector investment. Childcare needs support for so many reasons. First of all, supporting childcare is supporting families. And look, everyone on this meeting this morning, either in your personal circle or the people that you represent, knows that families are under incredible stress right now. I literally have no idea how some people are making it work. So childcare needs our support if parents are to return to work, if the economy is to reopen, if you want to support largely women and minority-owned small businesses, and if we want to maximize the first 5 years of children's life, which is the period of greatest brain development, when public investment can actually produce a significant return for our society at large. All families need access to high quality, affordable childcare, and that has financial implications and responsibility for the state to bear. Next slide, please. I'm just going to reinforce what you've already heard here, that while MSD reports that 87% of licensed childcare is reopened, and we are appreciative of all the efforts Stephen and Dr. Williamson and others have made to make that happen, that does not contradict the really catastrophic numbers our survey predicted and national surveys have predicted as well, that many, many childcare centers may still be in such a fragile and precarious position that they will still close before this is open. That 87% figure does not mean that doors are open, that children are enrolled, and that childcare is thriving. As someone said earlier, we still are at terrible risk. Again, with the winter coming, when things may get even more challenging. The providers you've heard from today are some of the most savvy, creative, talented providers in the state. And if their future is this precarious, what does this crisis mean to other providers in Maryland whose families rely on them and who are not sitting in front of you today? Thank you so much for your time. Clinton and I are happy to answer questions.
Wonderful, and thank you. And the first question we have is actually from Delegate Ebersol, who also chairs the Early Childhood Education, I believe it's called, subcommittee. So I wanted to have him speak for a minute, as well as Delegate Solomon did at the top, about the work they've been doing this interim, as well as ask this question.
So, well, thank you, Madam Chair. And actually, I'm not going to try to match what Delegate Solomon did, since I wasn't on board. I'll probably just repeat some things he said. I did come on a little late. And so for MFNI and the others, if they'd like to weigh in, but you have the data. My question is, one of our concerns at the start of the school year was how school-age children would receive care. And I'm curious if there has been if we have any sense of how many school-age children are receiving all-day care because their parents are still working and they can't stay home with them. And is that adding any additional students to the list of students they have, or are we finding that really most people are just pivoting at home somehow or another? What's your sense of how that came out?
Stephen, I don't know if you have any way of having tracked this from the state. I can tell you that anecdotally, I think there are 1,000 solutions happening, including the phenomenon of pods. We did hear a little bit about there are a handful of school systems that have made formal arrangements. I do not think, and this is purely anecdotally, and so if others want to jump in and contradict what I'm about to say, but I don't think specifically in Baltimore, which is where I live and where our offices are, for example, that childcare has gotten a significant increase in enrollment from school age children for a couple of really important reasons. One is many are not licensed to serve school age children. Second of all, the demands of virtual schooling and overseeing, whether it's the technology end of it or just the logistics of having children of different ages needing to manage different schedules and classes, has meant that it has not been a great match to hope that childcare can all of a sudden start serving school age children.
And I would add anecdotally that we have, and Diana, you can speak to this, you have served school age children and have prepared for them and are working with them, but we have heard that there is an influx. I think that based on what we see, schools are not opening even now and maybe into 2021, we may get more. But again, if we are viable at that point, we don't know, as Delegate Kelly mentioned. But Diana, did you want to mention, I know you are serving school age children, and I have many members that are serving school age children, doing their best with many different cohorts of ages and trying to work with their school systems.
Yes, we converted some of our empty classrooms to serve just kindergarten and first grade. We wanted to keep it at those ages to also keep our families who were scheduled to move on to kindergarten, and we're full with wait lists. So that has been a success for us. And that is actually one thing that's saving us right now, is being able to offer this to those school age children. They're having, I invite anybody to come witness it. It's really cool what's happening. Parents are thankful. We are getting emails and phone calls from public school teachers thanking our teachers for supporting the kids on our end. And families are just so appreciative that we were able to do this.
Thank you. May I add something as well? May I add something? I'm sorry. Yes. I just wanted to say too that I always had 5 spaces for school age children. So I am providing that, but I provide for 3 different counties. I have Howard County, Anne Arundel County, and Prince George County. At the beginning, I have to be honest, it was a nightmare, even for me being an adult. I saw children in classes crying of frustration because they may not have somebody who were able to support them. I also want to add the fact about the before and after care vouchers. that is something that is hurting the families. I have a family who can only be here 3 days because she's not able to pay, a full tuition of what I'm charging, and she only is getting before and after care. So yes, I do think that school age children need to have a full-time, voucher for them to be able to continue and families to continue to work. I know I wrote that many of you wanted to know how it's working. Some counties are doing, or the system is working very well. Others are very challenging. You must have an adult with the distant learning to assist the children. They are not able sometimes to do it on their own. They have to go and sign while in classes to different apps where they have passwords. So you have to have password. And can you imagine a kindergarten memorizing password if they don't have the assistance of an adult? And what about those who are, English is a second language? Families who are in there, they have no clue sometimes what is happening. I only have seen in Prince George County school system, somebody who can helping those people who speak another language. I had to be honest, in this particular case, and Anne Arundel County and Howard County, I haven't seen much of interaction of helping those parents who do not speak the language. Just wanted to add that.
Great feedback.
It sounded
So
like
I wanted to thank Diane and also Carolina for sharing their on-the-ground reflections. I really appreciate the service you are providing for our families and children. And I know it's extremely challenging right now. And I really do appreciate the input you've given, as well as all the providers that provide their reflections and their questions on our now monthly childcare calls, where we have anywhere from 400 to 1,400 providers sharing input with us. In answer to your question, though, school systems have worked in a variety of different ways. I mentioned this earlier, but I think you were not on the call. So some school systems have set up their own learning centers that is providing free childcare for school-age children. Some programs have contracted with vendors to come into their schools and provide childcare. We've worked with the YMCA, with Parks and Recs, with other organizations wishing to work to support these programs in expediting their licensing. A lot of before and after school programs that have wanted to extend to full day, we've expedited and provided some waivers in some cases for the professional development requirements so that those programs could serve the children. And as Chris mentioned earlier, some counties have really stepped up and provided financial assistance. I think that's very admirable to couple with the federal assistance and also the state assistance. We are standing by to help any other organizations to expedite licensing to provide for this need. And as you heard from these two outstanding providers, they are working to support families in their communities with school-age childcare.
So Steve, is what I'm hearing you say, and forgive me for putting it in probably not the best political words, but some counties are filling the gap, and MSDE's hope is that counties will pay to fill the gap so that we don't have to redirect that scholarship money to cover school-age childcare that is center-based?
Well, I think that we need counties to also play their part in supporting the childcare systems within the jurisdictions. It's not that we don't want to redirect the scholarship funding. We don't have additional scholarship funding to redirect. The current funding we have for FY21 in our budget as MSDE and the Division of Early Childhood was budgeted to cover for school age during the summer, for school age before and after school, and for children below school age for childcare services during the school year. We don't have additional funding to do that. Now, if Congress would permit and provide additional funding, we definitely could look at a plan to support childcare. And the $50 billion proposal by Congress that's been discussed has specific funding directed at shoring up the childcare system, and that is what we really need to
Does
have.
there exist somewhere in MSDE that you could
I'm
get
sure.
to the committee a chart that identifies the need for school age childcare, which counties are filling the gap, and how much of the gap they're filling, and what's left? Because I think that would, because I know that some places have done it. I know Montgomery is not doing a good job at all, and we're a pretty big county. I know a lot of other large counties are not doing a great job. So I think certainly it would be within MSDE's area of responsibility to figure out where the gaps are, so we know what kind of problem we need to solve, even if it means advocating for more money and figuring out how to get it.
Yeah, I appreciate that request, and I can talk to Dr. Williamson regarding that. I think it would require discussions with our local school systems to help us collect that kind of data, because there's no mechanism by which that's reported to us at the state level. But I think that's certainly an identified need that you have, and I can talk to Dr. Williams about that. Williamson.
Thank you.
Madam Chair, if I could just, so generally, we feel like we're we have more capacity than there's demand for school age, or our capacity is under, and there are people standing by. I heard somebody say they have a wait list, or is it kind of like Goldilocks? Is this just, are we at a pretty good balance point right now? What's your sense? I know we haven't gathered all that data, but do you have a sense that we're not serving enough people that want to be served, or that the child cares are available and waiting for more folks to step up?
May I answer this?
I know that they would like to fill those gaps. Would like to see the counties work with the child care programs that are already existing, those small businesses, as opposed to popping up new learning centers where you already have existing slots that are licensed and very well trained, and keep our workforce intact by utilizing those systems, as opposed to creating new ones that aren't necessary when we do have the slots available. And MSD has been really good about expediting changing those licensings to include school age children. So also even letting families know that there are those slots available in those childcare programs to support distance learners and support them while they're working. I don't think there's good communication. And I ask, as we close this out, and I know how much work you have to do, that there was a Maryland Child Care Recovery Work Group. We have not met since you received the media release of the information. We've tried to. I think it's important that we continue to have a group that meets, that discusses these issues and brings these to your attention, and maybe reports back to the JCCYF on these type of issues, to come up with creative solutions like I brought my members to talk to you about, and to bring this to the forefront, because we really do need to serve families and children better. And this is not, it's far from over. So we have a lot of work to do.
Thank you. Thanks.
Any more questions from members of the committee? I don't see any, but I just want to double check. Thank you all so much. Really appreciate it. We have 7 minutes for the last item in our agenda. So Senator Washington, are you online? Do you want to start talking about the recommendations?
Yes, I'm always here. So actually, I was hoping that staff, we talked about staff, right, doing that. If staff could walk us through. And again, we've heard, as you all have heard for the last 2 hours, we probably absolutely need to add some more specific things around childcare. So if those of you are thinking, maybe can think about some sort of conceptual wording for that. But if staff could read through these, and then if anyone can just have some comments, but we definitely want to make some recommendations in the area of children's services, childcare services, in the area of long-term care, and also the now what we're hearing. So if staff could read through, it'd be great.
Sure thing. So I'll start off. So the recommendation coming from the first meeting that happened on September 10th, this was where you had briefings from the local management boards and the Children and Youth Division of the Governor's Office for Children, or formerly Governor's Office for Children. So that recommendation is that the state should increase funding to local management boards and youth service bureaus, especially considering the 10% reduction that was made by the Board of Public Works. That reduction was to LMB grants in the Children's Cabinet Interagency Fund. And then
I do know that since there's just one in this area, I do know Senator Eckert, do you want to add to this or comment on this? I know you have a specific interest in our local management boards.
Thank you very much. I would just say assure that kind of funding, and if there are alternate ways of funding just to make up that gap, because those LMBs have been the glue that's held our other agencies together to meet all of the COVID demands. So I would just reinforce, to see if it's possible to restore that funding or backfill it with other funds that might be available. Thank you.
Thank you. Okay, and continue.
Sure. So then moving on to the second meeting, the committee held in October. It was on the issue of long-term care topics. And so the first two items, the state should take the following actions to improve and support long-term care services in Maryland by developing a COVID-19 testing protocol for residents, staff, and visitors at long-term care facilities, and improve active COVID-19 case reporting through the Maryland Department of Health COVID-19 dashboard. And then moving on to the second item, it's recommended that the state reject any proposed reduction to the mandated Medicaid and community services provider rate increase. And then I'll let Emily.
Yep, maintain the 4%. Thank you, Anne.
So I'm going to read the last three. So the next one is to support initiatives to expand and strengthen the long-term care workforce, including through online training and by retraining workers in the healthcare industry who are in need of employment to work in the area of long-term care. The next item is support efforts by long-term care providers to improve visitation and quality of life for residents, especially during the pandemic, where steps taken to prevent the spread of the disease may have inadvertently led to isolation. And then the last item is to adjust the balance of long-term care services and supports toward increased home and community-based services and to improve access to self-direction in the state.
And Delegate Kelly, this is your subcommittee. Do you have some thoughts about this? Or
Senator Eckert had something she wanted to say. Were you about to raise your hand, Senator?
I was. You are very sensitive, and thank you very much. Emily, review that first one again. I had something to add to that, if possible.
Sure. Yeah, so support initiatives to expand and strengthen the long-term care workforce, including... Right.
That's it. And just include in there, continue to access and work with the Department of Commerce on the EARN program.
Okay.
Because they work well, and if we can reinforce those and continue that, combination of economic development and workforce, I think that's critical. Thanks.
And then the only thing I would say about these recommendations are, we heard a lot of different things from stakeholders, and there was some agreement and some divergent opinions. So we tried to use language that was broad and find areas where we felt like there was agreement from the stakeholders to sort of create as our priorities to recommend to the Joint Committee.
And then also, if I would say, as co-chairs, we also are contemplating that we may need to establish some type of group of us to really think about these over the interim to really address the kind of long-term implications, not just of COVID, but all of the things that we're recommending.
Yep. Amen. Good.
Okay, so the last item is on childcare, and this was drafted before this meeting, so there may be additions. But the item is the state should continue to increase its investment in child care assistance, such as the Child Care Scholarship Program and Child and Dependent Tax Credit, and support child care providers, which are important to the state's economy as they continue to operate under and recover from the effects of the COVID-19 pandemic.
So the one thing I would suggest we maybe add, and this came up in the group chat among members, was the specific discussion of access to rapid testing, that maybe that's something we could as a committee recommend folks work on. And then the other thing that came up, and we can discuss this too, was trying to move forward on expanding utilization of the scholarship program for school day childcare for school age children, or some other funding stream, but at least acknowledging that need.
Delegate Kelly, this is Susan. I just wanted to mention, you go back to the Yale study. I think we've come a long way with our under 5 population, especially with having more information than we had a few months ago. And you know, the current Yale study was a huge study, 57,000 daycare centers in the United States. So I would just suggest that we use the current studies of risk to base our decisions. And also the same goes with asking for different things. There's only so much money to go around. What is the best use of the money? Is it, you know, rapid tests? Is it PPE? Is it scholarships? Because it's only so much. So we've got to somehow look at the data, look at the risk decisions that we're making. And this study was not just about students. It really was about adults as well, that, you know, they're not at any higher risk than the general population in their community. And it gives us a little bit of a idea how to move forward, because at the end of the day, the more we get back to a little bit of a normal with childcare, it's going to help staff these facilities and allow our parents to get back to work and just get a little bit more normalcy. And then the issue of using this study to decide whether to send kids home or close down a school because of other symptoms. It's huge. I mean, I've heard this over and over again now that it's fall. It's, you know, people have allergies. They've got runny noses. This is going to be an issue constantly with kids. They all have these symptoms, and so I think that's going to increase a lot as we move forward with colder weather. And we've got to use some common sense, giving the risk studies that have been done, and that at least we have that to fall back on. So I'm just asking that be at least acknowledged as these decisions are made.
I think that's a very fair point, that we can refer to that Yale study, and everybody who has the time take a chance to review it. We have the link here in the group chat if folks don't have access to it. Thank you, Emily, for sharing it.
Yeah, and I also want to send, and we'll consider these some comments from Ms. Reyes and Laura from MFN, but definitely filling out that workforce aspect, you know, the workforce that supports our workforce. And I think the committee hears very much that and we've known this before COVID, that it has not been sort of valued in the same level, and that you as small business owners have not been at the same level as I think your testimony around your comparison with the restaurants is very poignant and fair. And so we'll definitely figure out how we can incorporate some of these comments. Other folks, so conceptually, are we missing anything? Again, we're not taking a vote right now, but is there something we're missing? Do you feel comfortable? Does anyone sort of oppose? It's not a vote, but sort of more of a temperature check.
Another question I have, I'm sorry, this Delegate Krebs again. You know, we've talked about essential employees a lot. And when this whole pandemic started, we had this definition of essential employees. And to me, it was, you know, hindsight is 2020. We've never experienced this before. But, you know, looking back on it, I mean, it seems like everybody's sort of a part of that cog. And obviously daycare providers are a part of that cog. They are essential to many people. People can't go, nurses can't go back to work with their daycare, doctors, firefighters. So, and then the other people who were considered essential, again, we go back to liquor stores. I mean, I'm just going back at what we did then and what we're going forward. And we've got to consider that these are essential employees. I mean, we've got folks that they need to be prioritized.
Yeah.
I think Delegate Krebs, maybe we could add to the child care section a bullet point similar to the long-term care section, recognizing the workforce and you know, suggesting we prioritize the workforce in child care centers and recognize their essential function.
Yes, that'd be good.
Yeah.
Thank you.
And I think we have Senator Benson, and I think that's it on comments.
I was particularly concerned. Did you hear me? Are you with me?
We're with you.
Okay. I was particularly concerned about two things. Number one is the fact if a child has a runny nose, the child is sent home, and the center pretty much is closed down. That's a real concern. I don't know how we could put the kind of language in that would address that. Because if that continues through the winter here, the provider was exactly correct. It's going to close down more centers. So I'm just concerned about that right there. The second was I was very concerned about one of the providers talking about being included in the decision-making process, having a seat at the table. Is that something that we need to address? I mean, I think that what we have heard here this morning is just, it's really breathtaking if you want to know the truth about it. I mean, I'm just really concerned about that. I mean, this is a very difficult job. And those two things I'm asking if we could put some kind of language in our recommendation that would address those two issues that I'm concerned about.
It sounds like, I think the first issue that you addressed was similar to what Delegate Krebs was talking about in referring to the Yale study and talking about, making sure that our protocols for childcare centers are scientifically based and acknowledging the essential function of the business. So I think we can have some form of a draft recommendation that we'll come back with in that area. And also, if we can work on helping them access rapid testing, not necessarily cover the cost of it, but helping them access it the way long-term care facilities can now, that should help with the unnecessary closures.
Yeah, don't forget, Clinton just mentioned about the American Academy of Pediatrics. I mean, these are groups of people that have time to study all this stuff, and we need to use those. They base a lot of their information on the Yale study as well. So again, I'm very big also on this group having a seat at the table. I think as decisions were being made throughout the year this year, they really weren't being heard, and they know what's going on the ground. So I think that's a top priority, is making sure that they are there as these people are discussing the issues at MSD or wherever they're making the decisions, that they are there in telling what's happening in the real world.
Delegate, I agree that we can really lift up and assert this industry as really key to Maryland getting back to work, and asserting that they need to be part of the workforce and the business discussions, that they are vital to that, and they have not been. And this is an opportunity to assert that, not just for this crisis, but for the long term. And
they're doing a very good job. And they've done, without that, they're doing an excellent job.
Yeah, I mean, hazard pay, I mean, all these things that they probably be eligible for.
So maybe in the specific workforce bullet point, we also include, I think I heard Christina mention the Maryland Child Care Recovery Work Group had not actually met. So
Yes.
press release went out, but hadn't met. So we can specifically point to making sure to convene that and keep that seat at the table open. And
Yep.
Okay.
Can I add one thing here?
Of course, we're talking.
Thanks. This discussion that we were just having goes to the point I think I had brought up early on with Secretary Schultz, that, when she convened the Commerce Department work groups, that this is something that straddles between MSDE and Commerce. And I wish that we could bring in some of the Commerce expertise here with regard to the workforce issues.
Yep.
Agreed. Yep. Agreed.
I don't know if I'm allowed to say something now. May I?
Oh, go ahead, Carolina. Very quickly, though.
Yes, I just wanted to say thank you. Thank you, thank you, thank you. I finally, I can go back to my other providers, my teachers, that I finally felt that we are being included and we are taking, this particular time to be able to let our community and our society that childcare providers are essential. Yes, we are private, but yes, we are doing so much for our community. So I just want to say thank you for including us. Thank you for adding that little part of it that you're just talking about, that we are essential. That means a lot to us. That means a lot. So thank you.
Thank you. And thank you for the work you do every day, to you and all of the providers. We all appreciate it. We really do.
Delegate Kelly, I just wanted to piggyback off of what Senator Hedelman said. I know I'm not an official member of the committee, but on the recommendation front, we've been trying to work with Commerce on some of those economic development programs that already exist, that have money in them. So to Delegate Krebs's point about, we wish we had, more CARES Act money. And I think many of us are trying to figure out what's left and what can be used. But we've been trying to think creatively of, what economic development programs does Commerce already have at its disposal that, like a MEDAF or a SMBOTA that's already got, substantial sum of money in it. And how do we direct those to, to childcare programs when they already really qualify for it. And Commerce seems to be pretty open to that. I think they could use a little bit more nudging. So I think maybe even, and I'm happy to follow up. We had DLS pull, our committee council pulled some of the programs specifically within Commerce that could serve those purposes. So I can share that with you if you all want to put that directly in the recommendations.
I think that's a great idea, Delegate Solomon. If the committee's okay with that, we can work on making sure that bullet is really fleshed out with the work that Delegate Solomon and Ebersol and others have been doing outside of this committee, so we can all be on the same page with the same asks.
Yep.
And bring Commerce in. Great. Wonderful. Thank you, Delegate Solomon.
Thanks.
All right. I think we look like we're good, unless Senator Griffith, I saw you nodding your head. Is there any comments? No, yes. It's dangerous. I look at everybody. So.
No, I mean, I have just really appreciated all of the presentations and the comments from my colleagues. I, like Senator Benson and others, have concerns about those students that are in that sort of midday piece where parents have to now return to work and don't have, childcare or resources in place during the day. And like so many others, I see the overlap and the need to sort of cross-pollinate between MDH, MSDE, and Commerce around these issues. So I think everyone has raised the issues that I have been pondering as I've listened to the presentations.
Great, thank you.
So process-wise, Senator Washington, I don't, tell me if I'm wrong, and staff can please weigh in on this. I think that we can continue this conversation over email and refine and vote on the recommendations over email, so we don't need another meeting.
That is correct. Because we have, is that right, staff? Because we've discussed it conceptually and we're just refining it. At least that's what other joint committees are doing. So
yes, I believe that's true. And also these would go in the letter to LPC. So yeah, it can be as part of that conversation.
So I think then that makes this our very last meeting of the interim. And I would really like to thank the committee for their amazing support, but especially the staff. Anne and Emily have worked so hard to keep us on track and keep everyone, informed and get the right people to the table. So big round of applause. Thank you all. We really appreciate it. Senator Washington, anything to add?
Just that we have a lot of work to do, and I look forward to us getting into session and also what we can do during the interim. I know we've written letters, we've testified, we've done outreach. Every single member of the House and the Senate has been working, and this is I would say this is the most important work that we're going to be doing in the next 5 months, and so I look forward to doing that work with all of you. So take care. And if we had a gavel, one of us would hammer it now. So this meeting is adjourned. Thank you.
Thank you. Thank you.
Thank you. Gracias.
Good job, everybody. Thank you, Ms. Reyes.
Excellent